Assalamu alaikum. In the name of Allah, who is the most merciful and the most beneficent. Myself, Muhammad Zubair. Today, the topic of my presentation is Alprazolam and Midazolam. Here are some possible contents for my presentation. Introduction, chemical structure and properties, synthesis and reproduction, pharmacokinetics, therapeutic uses and adverse effects, and conclusion. First of all, I am going to explain introduction. Explanation of the benzodiazepine class of drugs. Benzodiazepine or benzos are a group of nervous system depressants commonly prescribed to treat stress, anxiety, or insomnia. They are also known. They act by facilitating the binding of the inhibitory neurotransmitter Gaba at various Gaba receptors throughout central nervous system. The benzodiazepine class of drugs is a group of psychoactive substances that are commonly used for their sedative, hypnotic, anti-anxiety, and muscle relaxant properties. Benzodiazepine work by enhancing the effect of neurotransmitter called gamma-aminobutyric acid in central nervous system. GABA is an inhibitory neurotransmitter that helps to regulate neuronal excitability in the brain. Benzodiazepines bind to specific receptors on GABA receptor, which increases the inhibitory effect of GABA. This leads to a reduction in the activity of certain brain areas, resulting in sedation, relaxation, and reduction of anxiety. It is important to note that while benzodiazepine can be effective in treating certain conditions, they also carry potential risks and side effects. These drugs can cause drowsiness, dizziness, impaired coordination, and cognitive impairment. Prolonged use or high doses can lead to dependence, addiction, and withdrawal symptoms upon discontinuation. Therefore, it is crucial to use benzodiazepine under the guidance and supervision of a healthcare professional. The second point for introduction is brief overview and history and views of alprazolam and midazolam. Alprazolam and midazolam are both benzodiazepine drugs with distinct characteristics and uses. Here is an overview of each drug along with a brief history. Alprazolam. Alprazolam is a short-acting benzodiazepine primarily prescribed for the treatment of anxiety disorders, panic disorders, and anxiety associated with depression. It works by enhancing the effect of GABA, resulting in a calming effect on central nervous system. Alprazolam was first introduced by the pharmaceutical company Upjohn, now part of Pfizer, in 1981 under the brand name Xanax. Since then, it has become one of the most commonly prescribed benzodiazepines in the United States and worldwide. Due to its potential for abuse and dependence, alprazolam is classified as Schedule 4 controlled substance in United States. Midazolam. Midazolam is a short-acting benzodiazepine primarily used for its sedative, anxiolytic, and amnestic memory impairment properties. It is commonly administered before surgical procedures, dental work, or medical interventions to induce sedation and reduce anxiety. Midazolam was first synthesized in the 1970s and was introduced for clinical use in the early 1980s. It quickly gained popularity due to its rapid onset of action and short duration of effect. The drug is available in various formulations, including oral, intravenous, and intranasal routes. Common uses for here is the third point for introduction. Common uses for each medication. Alprazolam Xanax. Alprazolam is primarily prescribed for the management of anxiety disorder, panic disorder, and anxiety associated with depression. It is also sometimes used as an adjunctive treatment for other conditions such as insomnia, muscle spasms, and alcohol withdrawal. Alprazolam is typically taken orally in tablet or extended release formulation. The dosage and frequency of administration depend on the individual's condition. The response to medication, it is generally recommended for short-term use due to the potential for dependence and addiction. Midazolam. Midazolam is primarily used for its sedative, anxiolytic, and amnestic effects. It is commonly administered in healthcare settings for various purposes. Procedural sedation. Midazolam is frequently used to induce sedation and reduce anxiety before medical procedures such as endoscopies, dental work, or minor surgeries. It can help relax the patient and promote cooperation during the procedure. Anesthesia adjunct. In some cases, midazolam may be used as an adjunct to general anesthesia to induce sedation and reduce preoperative anxiety. Seizure management. Seizure management, midazolam is also used in emergency situations to treat acute seizure, including status epilepticus. It can be administered intravenously, intramuscularly, or intranasally, depending on the situation and available routes. Agitation management. Midazolam may be used in hospital setting to manage acute agitation or delirium in patients who require sedation for their safety or to facilitate medical interventions. The specific dosage, route of administration, and duration of use for midazolam will vary depending on intended purpose and the patient's individual needs. It is important to note that both alprazolam and midazolam should be used under the guidance and prescription of a healthcare professional as they carry potential risks and side effects. Importance of these drugs in medicine. Midazolam injection is used before medical procedures and surgery to cause drowsiness, relieve anxiety, and prevent memory of the event. Alprazolam is used to treat anxiety disorders and panic disorders, sudden unexpected attack of extreme fear and worry about these attacks. Here the second point, chemical structure and properties. Midazolam. Chemical structure. Midazolam has a chemical name 8-chloro-6-chlorophenyl 1-methyl 4-hydrogen mono and benzodiazepine 3-carboxyl. Properties. Midazolam is a white to light yellow crystalline powder. It is practically insoluble in water but soluble in organic solvents such as ethanol and propylene glycol. It has a molecular weight of 3 to 5 grams per mole. Midazolam is a short-acting benzodiazepine with a rapid onset of action when administered intravenously, intramuscularly, or intranasally. Alprazolam chemical structure. Alprazolam has chemical name 8-chloro-1-methyl 6-phenyl 4-hydrogen triazolo and 1,4-benzodiazepine. Properties. Alprazolam is a white to off-white crystalline powder. It is slightly soluble in water but highly soluble in organic solvents such as ethanol and methanol. It has a molecular weight of 308 grams per mole. Alprazolam is a short-acting benzodiazepine with a relatively fast onset of action when taken orally. Structural formula for midazolam and alprazolam. Here the structure formulas for both midazolam and alprazolam. The structural formula for midazolam is called as follows: CH3 CH3 hydrogen with hydrogen, nitrogen with carbon, oxygen, nitrogen with chlorine, hydrogen with carbon, chlorine with carbon and nitrogen, carbon with hydrogen. Both carbon make bond with hydrogen. Here the structure formula for alprazolam is follows: hydrogen bonded with hydrogen, methane with nitrogen, carbon and oxygen, hydrogen bonds with hydrogen, nitrogen with chlorine, carbon with carbon, and hydrogen bond with carbon, nitrogen, and carbon makes bond with carbon, with carbon and hydrogen. The solubility and melting points of alprazolam and midazolam. Alprazolam solubility. Alprazolam is slightly soluble in water. It is more soluble in organic solvents such as ethanol and methanol. Melting points. Melting point of alprazolam is approximately 2 to 8.5 degrees Celsius. Midazolam solubility. Midazolam is practically insoluble in water. However, it is soluble in organic solvents like ethanol and propylene glycol. Melting point. Melting point of midazolam is approximately 136 to 139 degrees Celsius. Mechanism action of these drugs on human body. Both alprazolam and midazolam belong to the benzodiazepine class of drugs and exert their effect through a similar mechanism of action by enhancing the effect of gamma aminobutyric acid GABA, the primary inhibitory neurotransmitter in central nervous system. However, there are some differences in their specific pharmacological actions. Here is an overview of the mechanism and action of alprazolam and midazolam. Alprazolam. Alprazolam. Mechanism action of alprazolam. Alprazolam acts as positive allosteric modulator of the GABA A receptor. It binds to specific binding sites on the GABA A receptor complex, which consists of multiple subunits. This binding enhances the affinity of GABA for its receptor site, leading to increased chloride ion influx into the neurons and resulting in neuronal hyperpolarization. This overall inhibitory effect dampens neuronal excitability and reduces anxiety. Action: anxiolytic anti-anxiety. Alprazolam is primarily prescribed for the management of anxiety disorders and panic disorder by enhancing the inhibitory effect of GABA. It reduces excessive anxiety and promotes a sense of calmness. Sedative, hypnotic. Alprazolam has sedative properties and can induce sleep or drowsiness, particularly at higher doses. Muscle relaxant. Alprazolam poses muscle relaxant effects which can help alleviate muscle spasms. Midazolam. Mechanism action of midazolam. Similar to alprazolam and midazolam acts as a positive allosteric modulator of the GABA A receptor, enhancing the inhibitory effect of GABA. It binds to specific sites on the receptor complex, increasing the affinity of GABA for its receptor and leading to neuronal hyperpolarization and inhibition of neuronal excitability. Action: sedative hypnotic. Midazolam is commonly used for procedural sedation, inducing a state of relaxation and reducing anxiety before medical procedures. It has a rapid onset and short duration of action. Amnestic. Midazolam can cause anterograde amnesia, which means it impairs the formation of new memories. This property is useful during medical procedures where patients may need to forget the events. Anticonvulsant. Midazolam is utilized in the management of acute seizures, including status epilepticus. It acts to terminate seizures by enhancing Gaba inhibition in the brain. Synthesis and reproduction. Method of synthesis. Reaction of 2,6-dichloro-4-phenylquinoline with hydrazine gives 6-chloro-2-hydrazino-4-phenylquinoline. Non-binding with triethyl orthoacetate in xylene leads to heterocyclization to form triazole derivative. Midazolam. Method of synthesis. Start with compound 1,5-dimethyl 7-chloro 3 hydrogen 1,4-benzodiazepine 2,1, also known as oxazepam. React oxazepam with sodium hydroxide to form the sodium salt of oxazepam. Treat the sodium salt of oxazepam with methyl iodide CH3 to induce a methyl group onto the nitrogen atom of the benzodiazepine ring, yielding 1-methyl 7-chloro 3 hydrogen 1,4-benzodiazepine 2,1. React 1-methyl 7-chloro 3 hydrogen 1,4-benzodiazepine 2,1 with dimethylamine in the presence of base such as sodium hydroxide to form corresponding amine intermediate. Reduce amine intermediate using sodium borohydride or another reducing agent to produce midazolam. The resulting midazolam may be further purified and formulated into desired dosage form such as tablets or injectable pharmacokinetics. Drugs are metabolized and eliminated from the body through various processes, primarily carried out by the liver and the kidneys. Drug metabolism. Drug metabolism involves the biotransformation of drugs into different metabolites, which can be more water soluble and easily eliminated from the body. The liver is primary organ responsible for drug metabolism, although other organs such as intestines, lungs, and kidneys also contribute. Metabolism occurs through two main phases. Phase 1 metabolism. In this phase, drug molecules undergo reactions such as oxidation, reduction, or hydrolysis. Here the phase 2. In this phase, the drug or its phase 1 metabolites undergo conjugation reactions where they are combined with endogenous substances such as glucuronic acid, sulfate, glycine, or glutathione. This conjugation process further enhances the drug's water solubility. Drug elimination. Elimination refers to the removal of drugs and their metabolites from the body. The kidneys are the main organ responsible for elimination drugs and their metabolites through urine. Other routes of elimination include bile feces, sweat, saliva, and exhaled air. The two primary processes involved in drug elimination are renal excretion. Water-soluble drugs and their metabolites are filtered by kidney and some are actively secreted into the urine. This process is facilitated by transporters present in the renal tubule, biliary excretion. Some drugs and metabolites are eliminated via the bile into the intestine. From there, they can be further metabolized by gut bacteria or excreted in feces. Several factors that can influence the pharmacokinetic weight. Body weight can affect drug distribution and clearance. Some key considerations include body composition. The distribution of drugs can be influenced by factors such as body fat percentage, lean body mass, and total body water content. Drugs with high lipophilicity tend to distribute more into fatty tissues, while hydrophilic drugs may have a larger volume of distribution in individuals with higher body water content. Dosing adjustments. In certain cases, drug dosage may need to be uh, adjusted based on body weight to achieve optimal therapeutic levels. This is often seen with medications and have a narrow therapeutic index or in pediatric patients. Age. Age-related changes can impact drug pharmacokinetics, particularly in children and elderly pediatrics. In children, age-related differences in drug absorption, distribution, metabolism, and elimination can occur due to organ immaturity and developmental changes. Dosage adjustments may be necessary to ensure appropriate drug exposure and minimize the risk of adverse effects. Geriatrics. Elderly individuals may experience changes in drug pharmacokinetics due to age-related alterations in organ function, reduced liver and kidney clearance, and altered drug distribution. The potential for drug interactions and increased sensitivity to certain medications should also be considered in this population. Disease state. Various diseases can influence drug pharmacokinetics through changes in functions and blood flow. Liver kidney dysfunction. Impaired liver or kidney function can lead to decreased drug metabolism and elimination, potentially resulting in increased drug exposure and prolonged half-life. Dosing adjustments may be necessary to avoid toxicity in individuals with liver or kidney disease. Cardiovascular disease. Altered blood flow, changes in cardiac output, and impaired tissue perfusion associated with cardiovascular diseases can affect drug distribution. Drug interaction and their effects on pharmacokinetics. Drug induction can occur when two or more drugs interact with each other, leading to changes in their pharmacokinetic absorption, distribution, metabolism, and elimination, and potentially altering their therapeutic effects or causing adverse reactions. Here is an overview of drug interaction and their effects on pharmacokinetics, absorption, interactions. Drug-food interaction. Some drugs may have altered absorption when taken with certain food or beverages, which can affect their bioavailability. For example, grapefruit juice and inhibit the activity of intestinal enzymes, leading to increased absorption and higher blood levels of certain drugs. Distribution interactions. Protein binding interaction. Drugs that extensively bind to plasma protein may interact with other drugs or substances that compete for protein binding sites. This can result in increased level of free unbound drug in the blood, potentially leading to enhanced pharmacological effects or toxicity. Metabolism interactions. Enzyme induction inhibition. Certain drugs can induce or inhibit drug metabolizing enzymes in liver, such as cytochrome P450 enzyme. Enzyme induction can accelerate the metabolism of other drugs, reducing their effectiveness, while enzyme inhibition can slow down the metabolism, leading to increased drug concentration and potentially higher risks of adverse effects. Elimination interaction. Renal transport interaction. Drug interaction can occur at level of renal transporters responsible for drug excretion. Inhibition or induction of these transporters can affect the renal clearance of drugs. Therapeutic uses. Alprazolam and midazolam, both belonging to the benzodiazepine class of drugs, have therapeutic uses and indications. Alprazolam, anxiety disorder. Alprazolam is commonly prescribed for the treatment of generalized anxiety disorder, panic disorder, and social anxiety. Panic disorder. Alprazolam is effective in the management of uh, panic disorder with or without agoraphobia. Anxiety symptoms, which can be used to alleviate symptoms of anxiety such as restlessness, tension, and irritability. Here the source of information. Midazolam, sedation and anesthesia. Midazolam is commonly used for sedation before medical procedures such as endoscopy or surgery to induce relaxation, reduce anxiety, and induce amnesia. Procedural sedation. It is used to facilitate procedures that require patient cooperation, such as dental procedures or diagnostic imaging. Anesthesia adjunct. Midazolam is sometimes used as an adjunct to general anesthesia to enhance its effects or reduce the amount of anesthetic agents needed. Acute seizure. In emergency situations, midazolam can be administered intravenously or intramuscularly to treat acute seizures, including status epilepticus. Comparison with other benzodiazepine and alternative drugs, alprazolam and midazolam are two benzodiazepine commonly used for different purposes. Let us compare them with other benzodiazepine to provide a broader understanding. Diazepam. Diazepam is a long-acting benzodiazepine used for anxiety, muscle relaxation, and as a sedative. It has a slower onset of action and a longer duration compared to alprazolam and midazolam. Lorazepam. Lorazepam is an intermediate-acting benzodiazepine primarily used for anxiety disorders and as preoperative sedative. It has a slower onset of action compared to alprazolam but a longer duration of action than midazolam. Clonazepam is a long-acting benzodiazepine used for the treatment of seizures, panic disorder, and certain anxiety disorders. It has a slower onset of action and a longer duration compared to both alprazolam and midazolam. Chlorodiazepoxide is a long-acting benzodiazepine commonly used for alcohol withdrawal and anxiety disorders. It has a slower onset of action and a longer duration compared to alprazolam and midazolam. Temazepam is an intermediate-acting benzodiazepine primarily used for the short-term treatment of insomnia. It has a slower onset of action and a longer duration compared to midazolam, but a shorter duration compared to alprazolam. Later research finding on efficiency and safety of these drugs. Alprazolam is primarily used for the treatment of anxiety and panic disorder. It is known for its anxiolytic properties and relatively rapid onset of action. Several clinical studies have demonstrated the efficacy of alprazolam in reducing anxiety symptoms. However, due to its potential for dependence and abuse, uh, Alprazolam is generally recommended for short-term use and with caution in individuals with a history of substance abuse. Regular monitoring and gradual dose reduction are recommended when discontinuing alprazolam to minimize withdrawal symptoms. Additionally, alprazolam can cause sedation, cognitive impairment, and other side effects. So, its use should be carefully evaluated on individual basis. Midazolam. Midazolam is commonly used as a sedative, anxiolytic, and for the induction and maintenance of anesthesia. It has a rapid onset of action, making it suitable for procedures requiring quick sedation. Midazolam is available in different formulations, including oral, intranasal, and intravenous, providing flexibility in its administration. It is generally well tolerated, but side effects such as drowsiness, confusion, respiratory depression can occur, particularly with higher doses. Rapid intravenous administration. Adverse effects. Here, common and serious effects associated with alprazolam and midazolam. Both alprazolam and midazolam can have common and serious effects. Common effects of alprazolam: drowsiness, sedation, fatigue, dizziness, impaired coordination, memory problems, slurred speech, headache, nausea. Common effects of midazolam: sedation, drowsiness, amnesia, memory loss, dizziness, disorientation or confusion, dry mouth, nausea, and vomiting, injection site reaction for intravenous administration, respiratory depression at higher doses or rapid intravenous administration. Serious effects of alprazolam: paradoxical, paradoxical reactions, increase in anxiety, agitation, hostility. Respiratory depression, especially in high doses or when combined with other respiratory depressants like opioids, dependence and withdrawal symptoms if used long term in or in high doses. Allergic reactions, rash, itching, swelling, severe dizziness or difficulty in breathing. Serious effects of midazolam: respiratory depression and respiratory arrest, especially with rapid intravenous administration or high doses, hypotension, low blood pressure, and cardiovascular effects. Paradoxical reactions similar to alprazolam, allergic reactions, rash, itching, swelling, severe dizziness or difficulty breathing, prolonged sedation or anesthesia effect. Strategies for minimizing adverse effects and improving patient outcomes. To minimize adverse effects and help patients to overcome any challenges associated with the use of alprazolam and midazolam, the following strategies can be considered. Individual dosage. Prescribing the lowest effective dose for the shortest duration can help reduce the occurrence and severity of adverse effects. Tailoring the dosage based on the individual patient factors such as age, weight, medical history is crucial. Regular monitoring. Close monitoring of patients during treatment can help identify any adverse effects early on. This includes regular assessments of vital signs, respiratory function, and cognitive function. Adjustment to the dosage or treatment plan can be made if necessary. Patient education. Providing patients with thorough information about medication, its potential side effects, and what to expect can help them better manage and understand their treatment. Educating patients about the importance of following prescribed dosage and potential risks associated with the medication is vital. Gradual tapering. When discontinuing benzodiazepine, including alprazolam and midazolam, a gradual tapering approach is generally recommended to minimize withdrawal symptoms and rebound effects. Tapering should be done under medical supervision and according to the individualized plan. Monitoring for drug interaction, alprazolam and midazolam can interact with other medications, including opioids and certain antidepressants, leading to increased sedation and respiratory depression. Healthcare professionals should assess potential drug interactions and adjust medication regimens accordingly. Regular follow-up visit with the prescribing healthcare professional, allowing for ongoing assessment of treatment effectiveness, monitoring of adverse effects, and necessary adjustment to the treatment plan. It also provides an opportunity for patients to address any concerns or difficulty that may be experiencing. Non-pharmacological approaches. In some cases, non-pharmacological approaches such as cognitive behavioral therapy, relaxation techniques, and lifestyle modifications may be used as adjuncts or alternatives to benzodiazepine treatment. These approaches can help patients develop coping mechanism and reduce reliance on medication. Conclusion. Recap for the main points covered in the presentation. Here, the recap for the main points regarding alprazolam and midazolam. Introduction. Alprazolam and midazolam are benzodiazepine medications. Alprazolam is primarily used for anxiety and panic disorders. Midazolam is commonly used as sedative, anxiolytic, and for anesthesia induction and maintenance. Chemical structure and properties. Alprazolam and midazolam belong to the benzodiazepine class of compounds. They have a similar basic chemical structure consisting of benzene ring fused with diazepine ring. The specific chemical structure and substitutions determine their pharmacological properties, synthesis and reproduction. The synthesis of alprazolam and midazolam involves complex organic chemistry processes, including several reaction steps. Detailed synthesis procedures are carried out in laboratory settings by experts in organic chemistry. Pharmacokinetics. Both alprazolam and midazolam are well absorbed after oral administration. They undergo metabolism in the liver, primarily by the enzyme CYP3A4. Alprazolam has a relatively short half-life and is quickly eliminated from the body, while midazolam has a shorter duration of action. Therapeutic uses. Alprazolam is primarily used for the treatment of anxiety disorder and panic disorder. Midazolam is commonly used as a sedative, anxiolytic, and for anesthesia induction and maintenance during surgical procedures. Adverse effects. Common adverse effects of both alprazolam and midazolam include sedation, drowsiness, impaired coordination, and dizziness. Serious adverse effects can include respiratory depression, paradoxical reaction, dependence, withdrawal symptoms with long-term use or high doses, and allergic reactions. Adverse effects may vary among individuals and depend on factors such as dosage, duration of use, and individual susceptibility. Implication for future research and development of alprazolam and midazolam. Future research and development of alprazolam and midazolam can focus on several key areas to further enhance their therapeutic benefits and address potential limitations. Efficacy and safety. Conducting well-designed clinical trials to further evaluate the efficacy and safety profiles of alprazolam and midazolam, including their comparative effectiveness with other treatment options. exploring long-term effects and optimal duration of use for different medical conditions, investigation, potential strategies to minimize the risk of dependence, withdrawal symptoms, and rebound effect associated with benzodiazepine. Pharmacokinetics and formulation, developing new formulation or delivery methods for improved pharmacokinetics, such as extended release formulation to optimize therapeutic outcomes and reduce the frequency of dosing, exploring alternative routes of administration and enhance convenience, patient compliance, exploring alternative routes of administration, enhance convenience, patient compliance, and absorption, such as transdermal patches or intranasal sprays. Pharmacogenomics and personalized medicine. Investigation the role of pharmacogenomic factors in determining individual responses to alprazolam and midazolam, allowing for personalized dosing and treatment selection. Exploring genetic markers that can predict the risk of adverse effects or treatment response, enabling the more tailored and effective use of these medications. Novel indication. Assembling the potential of alprazolam and midazolam in treating the other medical condition beyond their current approved indication, investigation their efficacy in specific populations such as pediatric or geriatric patients where the safety and efficacy profiles may differ. Combination therapy and drug interaction. Evaluation the use of alprazolam and midazolam in combination with other medications to enhance treatment outcomes while carefully considering potential drug interaction and safety implications. Alternative treatment approaches. Exploring non-benzodiazepine alternatives or complementary treatment approaches for anxiety disorders, panic disorders, sedation, and anesthesia induction to address concerns related to tolerance, dependence with withdrawal associated with benzodiazepine, risk-benefit assessment and education. Conducting a comprehensive risk-benefit assessment to inform healthcare professionals and patients about the appropriate use, potential risks, and benefits of alprazolam and midazolam. Enhancing the patient and healthcare professional education on the safe, responsible use of these medication, including proper dosing, potential side effects, and importance of regular monitoring. The role of chemistry in discovery and development and production of these drugs. Chemistry plays a vital role in the discovery and development and production of medications like alprazolam and midazolam. Drug discovery. Chemistry is crucial in initial stages of drug discovery, where medicinal chemists design and synthesize new compounds based on the desired pharmacological effect. Chemists utilize their knowledge of organic chemistry to modify existing molecules or create novel structures that exhibit the desired therapeutic properties. Through structure activity relationship study, chemists explore how different chemical modifications affect the drug's potency, selectivity, and pharmacokinetics. Drug development. Chemistry is involved in optimizing drug candidates to improve their pharmacological properties, such as increasing potency, enhancing stability, and reducing toxicity. Medicinal chemists perform lead optimization by relatively modifying the chemical structure of a compound to improve its efficacy and selectivity. Chemists also collaborate with other disciplines such as pharmacological and toxicological to assess the pharmacokinetic safety and metabolic pathways of the drug candidate. Synthesis and production. Synthesis and production. Organic synthesis play a significant role in producing alprazolam and midazolam on a large scale. Organic chemists develop efficient synthetic routes to produce these drugs with high yields, purity, and cost effectiveness. They optimize reaction conditions, design synthetic strategies, and develop scalable processes for large-scale production. Quality control and analytical chemistry ensure that the synthesized compound meet the required purity and specifications. Structure elucidation. Chemistry techniques such as nuclear magnetic resonance, mass spectrometry, and X-ray crystallography are utilized to determine the chemical structure of the synthesized compound. Structure elucidation helps to confirm the identity and purity of the final product and ensures consistency during manufacturing. Formulation and drug delivery. Chemistry play a role in formulating alprazolam and midazolam into different dosage forms such as tablets, capsules, solutions, and injectables. Chemistry work on developing appropriate formulation that provide optimal drug release, stability, and patient acceptability. They also explore the techniques for drug delivery, such as controlled release formulation or novel drug delivery systems to improve therapeutic outcomes and patient convenience. Here the end of my presentation. Thank you.